effective approaches that have been tried all over the world. Today's session's title is Lessons Learned from Evidence-Based Research. Our overall database has had more than 1,000 case studies, and we have covered in-depth case studies of over 125 cases, which are all available on a website called One World Connected. We here today will talk about some of the lessons that we have learned from studying these case studies from all over the world. And we have amidst us a very distinguished panel. I will introduce them briefly at this time, and then I will open the floor to them. I wanted to have some house rules in terms of how this discussion will go. First, we will have introductions of the panelists by myself, and then we will have presentations along 3 dimensions: digital skills, community networks, and healthcare. Once for each segment of the session, we will have a presentation by a member of the coalition and a commentator by someone who is an expert in that space to make sure that we have and reflect perspectives about what we know about these things in terms of connecting underserved communities. After that, we will have a dedicated segment for Q&A, as well as any comments that that commentators might have, that attendees might have for this session. If you have any questions that are clarificatory, please post them in the Q&A section. If you are using the chat, please change your default to all panelists and attendees so everyone is aware of the questions that you're asking. As a rule, we would like to do all the questions and comments at the end. And if there are clarificatory questions, the panelists can type answers as we go along. Thank you very much. So today, on behalf of the Dynamic Coalitions panel, we have Professor Christopher Yu from the University of Pennsylvania's Law School. He will be presenting our Dynamic Coalitions work on digital skills. Commenting on that is Claire Sipthorpe from the GSMA, and she will be commenting on the digital skills segment and the lessons that we have learned on digital skills. On community networks, we have Leon Gawaka, who is a postdoctoral fellow at the University of Pennsylvania, who will be talking about his work and learnings from the community networks segment of the session. And commenting on that, we will have Dr. Leandro Navarro from Catalonia, who has been involved in one of the largest and most successful community networks, Guifi.net. Then we will have Dr. Muge Haseki, who will be talking about the work that we have learned on mHealth and digital health interventions as part of the Dynamic Coalition. And commenting on that will be Dr. Sherbani Belur, who has been a research scientist at IIT Bombay and is currently working in incorporating healthcare messaging as part of her new role. And I would therefore now request for the first segment to kick off. Professor Yu, over to you.
Well, thank you very much for the great introduction and for launching us off. I will note in the chat, there is a reminder that this is being recorded and the event is being held under the code of conduct of the IGF. As one of the co-conveners of this Dynamic Coalition, I'm delighted to have the opportunity to share what we've learned, and to really focus, my part will be on the digital skills programs. Just so everyone, it's just to frame it a little bit more broadly, since we're at the beginning, the whole Dynamic Coalition and the work we're doing is framed by the idea that we need evidence-based decision-making. We find that there are many innovative efforts going on around the world. Many of them have no measurement whatsoever, so we have no idea what is working and what is not, which forces every project to reinvent the wheel and makes it impossible for us to learn from prior projects and to take that learning forward. Second, we discovered the places that did have the information, such as certain international organizations, couldn't really do the evaluative work because of the nature of their role as an international organization. They couldn't take the position that certain projects were more successful than others because that would jeopardize their political standing. So they actually encouraged us to do this work. And you're seeing today 3 different aspects of our desire to push this forward, so people are not just giving you their opinion or even worse, sometimes people are pushing the business model or the product they have available to you to try to convince someone to do this. We are hoping that policymakers, regulators, industry, and everyone will use the information that we pull together to solve the problem we're all here trying to solve, which is to ensure that every global citizen enjoys the benefits of internet connectivity. So specifically, we've generated a database of over 1,100 connectivity initiatives. It's available on our website, oneworldconnected.org. We've contacted all of them, and we've done over 125 case study interviews, which are now written up in case studies, also available on the webpage. Today, my segment is about digital skills. Just to let you know, this is one of the largest segments in the overall database, consisting of 339 entries and 44 case studies, therefore well over a third of the total amount of what we discovered. So we discovered in writing this up that there's very little good information, a lot of opinion about what makes for digital skills, what are they, and what makes a good initiative. And so I'm going to present to you what we found. First is the regional distribution and the scale. As should be probably unsurprising, a large percentage of these are concentrated in Asia and Africa. There are additional digital skills initiatives in Latin America, North America, Europe, and Oceania at lower levels. We are always reminded, and we'll talk about this in terms of vulnerable populations, there are aspects of this in terms of low income, in terms of gender, in terms of senior citizens, in terms of disability access, where we need some sort of digital skills initiatives often in every part of the world, no matter what its socioeconomic status. But we do see the majority of them, 75% of them in Asia and Africa. They also occur at very different scales. A quarter of them are local, but many, a good 70% of them are larger than local, either on a regional basis or a national basis. And this is an important decision when launching such an initiative to try to evaluate the scale at which you would like it to operate. Target populations vary widely. 43%, the largest proportion, are focused at students, often through in-school training or specifically after-school training. 20% to 6% are targeted on the basis of gender to try to increase and empower female populations. 13% are done to youth out of school. And as we have mentioned earlier, there are other lesser represented groups, including the seniors and disabled, which are occasionally targeted, but generally not a primary target in our database. Geographically, roughly speaking, it's 50% in rural areas, 25% in urban, and of course, many initiatives, particularly the national ones, will span both. So we do see a disproportionate emphasis of the training, appropriately so, in the rural areas. In terms of how that it's actually delivered, this is an area about which very little study has taken place. The question is, there's a great question about whether you do it through a computer as depicted in this photograph, through a mobile device, or through a handheld device or a tablet. And there's an obvious question about reach and in terms of cost. If you can do it through mobility-based devices, you could reach a lot more people quickly and do it more cost-effectively. We do discover just under 2/3 of the training is currently computer-based. And second, do you do the training in person or online through some sort of streaming situation or through an app? And we discover that 84%, the vast majority of the training, is delivered through in-person training. The content varies widely. There can be everything from basics training and literacy to employment and work-related training, education, entrepreneurship, social skills, financial literacy, e-government, health, and agriculture. This is in descending order of importance, basic training being the most common, all the way down through employment and education. And this raises an interesting question. We talk about digital skills as if everyone knows what it is and it's a unitary phenomenon. We all know that, in fact, there's some important choices about how to focus them. And here, it's not just a question of doing one versus the other. You probably need some mix of a wide range of subjects. It's a question of how do we marshal scarce resources and attention to create a portfolio of content and approaches that serves the goals of society. In terms of how large the programs are, there are, they differ whether they're focused on individuals or focused on institutions. There are a very small number of very large scale, that is over 1 million programs, programs targeted over 1 million people. But what you see is a significant number of medium-sized programs targeting over 10,000 to 1 million, or 1,000 to 10,000. So we see very large-scale projects or medium-scale projects that are much part of this mix. In addition, there are some that are targeted institutions, a large number targeted a very large number of institutions, and other that are smaller scale. One of the most difficult problems that we face is actually, how do you make these programs sustainable? Many of the times, two-thirds of the times, roughly, they're funded by grants, some by corporate social responsibility, some by governments, and some by subscriptions. And with the ones that are not funded by subscriptions, their sustainability depends on the continuing support of the funding agency. And in that sense, we are encouraging funding agencies to do that on a conscious basis, to know that if you need to keep providing funding in order to sustain, you need to know that in advance. Done by different stakeholder groups, mostly by NGOs, but also private sector, government, and volunteer-led civil society and academia. One of our panelists, Sharbani, Dr. Balur, is one of the people who's doing it from an academic standpoint, and is a wonderful person who's also doing community networking. Different programs use different impact assessments and different indicators. Most use qualitative measures, some use quantitative measures. The qualitative ones tend to be surveys, others attempt to find some metrics, and a small number do both. And they focus on different impact indicators, whether they're employment, academic performance, empowerment, financial wellness, and health. So there are a number of challenges which we ask them to talk about. The biggest one is lack of sustained funding. Others are electricity access, lack of manpower to keep the systems operational, access to devices, internet access, resistance from the community, and the need for locally relevant content. So in short, we are hoping that the work we're doing will lay a platform for success. And what's critical to us about doing evidence-based decision-making is develop the tools to evaluate impact, to find out what's working and what's not, so we can learn from initiative to initiative and improve. We have to make sure that people who are deploying new projects, that they include resources and time and effort to evaluate their success. Otherwise, we can't progress and we can't actually validate what's working. We have to identify the types of training, whether it's, as I said, basic skills or other types, which populations to train, determine the best mode for delivering it in person, through apps and the like, or versus classroom, computer-based, mobile-based. Identify the curriculum needed for each type of training, look at sustainability, analyze ways to overcome challenges, and to curate eventually a repository of resources that the others can draw on, so every person doesn't have to create them from scratch. If you are interested, here's our website, and thank you very much for your time. And I turn the floor over to Claire.
Thank you for that presentation. I now invite Claire Sipthorpe to present any comments.
Great, thanks so much. And it was great to hear that presentation, Christopher. Really important to have data on this. It's such an important issue, and there's such a lack of data. I'll maybe start with a couple comments about the sort of broader issue and why we focus on it, and then what we've learned in terms of and know about in response to some of the points that you made. So while we know there's been great strides in delivering digital inclusion and connecting the unconnected, the kind of broader topic of this session, but we know that there's still big key barriers. So for example, there's a coverage gap of people who live outside areas not covered by mobile broadband networks, but that's about 600 million people. But much more importantly, there's a usage gap. So when we look at, we have a lot of data on mobile internet and mobile usage. So there's approximately 3.4 billion people who live outside areas covered by mobile broadband that are not using it. So basically, there's coverage, but they're not using it. And that's 6 times bigger than the coverage gap. And so when we look at what are the reasons, why are people not using the internet? Why are they not digitally included? Our research, and we do nationally representative surveys, and we have a lot of data on this, is that digital skills and literacy is the top barrier to mobile internet use among people who have a mobile and are aware of the internet. So this encompasses both traditional literacy, as well as the ability to use a phone and use the internet. So clearly tackling digital skills as an important issue to connecting the unconnected and making sure people can effectively access and use the services. And I think it was really great that you highlighted gender and disabilities. We again see that these are segments of the population where there's a significant gap. So, for example, in the gender gap, we see since 2017 it's declining, but there's still women are 20% less likely than men to use mobile internet in low and middle income countries. So there's a big gap. I need to focus on that. Similarly, we're doing research on people with disabilities, and we're seeing again gaps there, significant gaps there. So it's great, and I would encourage anybody who's looking at digital skills to sort of look at who does need those skills, who's not being reached, and try and focus on that. So just to respond to some of the stuff you also said, you mentioned that a lot of the delivery of digital skills training is computer-based, and that's also when we do our landscaping research and our work in this area, we're seeing that too. But I think that's a challenge. And again, when we do some research in space, we see it, according to the ITU, for example, mobile accounted for 87% of broadband connections in developing countries. In our surveys, again, we found that a high proportion of respondents access the internet exclusively over the mobile. So they don't have any other way of accessing it, particularly in Africa and Asia. And so I think this is really important because we have looked at, done some research around whether the digital skills training people are receiving is giving them the skills they need. And what is finding when the training is not delivered on the device that they are using, I mean, it's sort of probably obvious, but when it's not delivered on the device they're using, it doesn't give them the skills they need to access and use and safely use digital services they need. And so when people are not receive training on, for example, computers and laptops, they're getting stuck on app islands. When they go into a phone, they don't know how to download apps, they don't know how to search content, they don't know how to have the skills to effectively manage and access the internet on their phone. So, and in fact, that training is not giving them the skills they need to use it. So I think an important issue is to think about the groups that you're targeting and who you're trying to reach, and what are the platforms and tools that they're using, and making sure that the digital skills training is appropriate to that. And a number of the challenges we also see when delivering digital skills programs, and again, not surprised by what you presented in some of the barriers, is that again, our research and our work in this area shows that this cannot be looked at in isolation, but it needs to be looked at in the context of the range of the barriers that face by people trying to use these digital services. And specifically, I would call out, again, what our research is showing is affordability, particularly handset affordability. That is a primary barrier to having a phone. That is also a second biggest barrier to using the internet after digital skills. So if people can't afford or access the devices, the digital skills training isn't going to be very effective. There are also barriers around concerns around safety and security issues, ensuring there's relevant content and services are available. And I would say that, again, in our research, though, we're seeing that video consumption has been rapidly growing in the last 2 years. So this is pre-COVID data. I assume it's much even higher now. But that means that it's providing an accessible way to access content, particularly for those who have low literacy and digital skills. And it's also, I think, an important thing to think about. While we can't replace face-to-face training, but sort of some of this sort of digital training material and content is particularly potentially useful in the context of COVID, where people are constrained and there's many restrictions, but we're seeing a much higher uptake and use and ability to use and consume and produce video content amongst some of the populations that we work with in low and middle income countries. And then issues of social norms and family disapproval and structural inequalities between men and women around education income are also playing a big part in being able to access and use these services. So I would say that when you're delivering digital skills training programs, what we're seeing is that you just, as far as possible, need to address the wide range of barriers through partnerships and other efforts. And that if it's not addressed, then actually these training content and materials are not fail to reach many and perhaps reinforce some of the existing inequalities we're seeing in the digital space. And that they absolutely need to be grounded in the understanding of the local context. So, for example, for gender, understand and address women's needs and barriers. Think of issues like social norms, and that the participants, so women and whoever you're trying to target, need to be involved in the design and implementation of these training contents. So we I think this will also help identify the kind of training that's needed. And again, you mentioned in your slides about, where do we focus our efforts? So at GSMA right now, we have a mobile internet skills training toolkit, which is focused on getting people who just have the basic skills to access and use the internet. It's freely available. It's being implemented by a range of countries. It's now reached over 2.2 million citizens that we're aware of. It's primarily used by mobile operators, but also increasingly by others. But we developed the initial modules looking at, again, taking a research evidence-based approach, researched what people wanted, and did a user-centered design approach, and identified that as people were looking for what are the basics on the internet, how to keep themselves safe, how to understand costs and reduce costs, as well as key modules on apps. So that's an area that we started to develop some content on, but we're now currently doing a more detailed research to understand the digital needs and capabilities of people in Africa and Asia, and sort of understand the journey from people when they first own a phone to use the internet to use it more widely, and we'll be sharing that. But I think, so I basically am saying I agree it's critically important that we need to focus on this issue. And it would be great to see when you present next year, if we can have more, an increased consideration of mobile, just given how important it is as a tool for people. And in fact, because we've, I think it's such an important issue, we think that we need to collaborate more on this. We're just in the process of establishing a community of practice. We're calling it the Mobile Digital Skills Alliance, that's sort of dedicated to generating and sharing insights on the space to drive collaboration. And anybody who's participating here is interested in being part of that. We feel that we need more collaboration, more research, more evidence. But I would just say that I agree with a lot of what you're saying, Christopher, and I just think it's really important they focus on this and also think about it in the context of the wider barriers as well, if we're going to be successful in delivering these initiatives. So thank you very much.
Thank you so much, Claire, for those comments. If there are any questions on the digital skills, both the findings as well as on the commentary that you just heard, please do post your questions in the Q&A panel, and we will try our best to take them for discussion at the end, but also if there are clarificatory questions, we will take them through the course of the presentation. We have a slight change in order, and next we will actually have the healthcare segment, and I would like to invite Dr. Muge Haseki to present our findings on digital healthcare, especially in areas that are underserved and unconnected. And we'll have the community network section after that. Muge?
Thank you, Sharda. May I share my screen now for my presentation?
Yes, I think you should be able to.
All right, it says sharing screen has failed. Let me try again. All right, it worked this time. Hello, everyone. Next, I would like to present some of our findings on health. So over the past couple of years, we have generated 13 case studies on health, 5 of which were on maternal health. And then we decided we wanted to know those 5 maternal health services scaled at different levels and also had different outcomes. So we were curious what made them, in what ways they were similar and different, and why they scaled at different levels, although they started at similar time frames. And some of them were more successful in terms of reaching their own goals and changing the health behavior of pregnant women. So we examined 5 maternal health applications, but today I would focus on 2 of them, given our 10-minute time frame, and kind of compare and contrast 2 maternal health applications in South Asia. We wanted to know what challenges they face, what challenges women face in those areas, and how maternal mobile health applications can address those challenges through design and change the health behavior of women in intended ways. So I'm sure everyone in IGF and in this panel are aware of the increase in digital health, digital infrastructure all over the world. So here you see how digital infrastructure has expanded over the past 10 years. The 2 maps from GSMA show those expansion very vividly. And that also led increase in the mobile health initiatives over the past several years. So here you see a map from PATS 2015. More than 500,000 mobile health initiatives have been implemented over the past 10 years. But unfortunately, only around 700 of them are currently active. So this also led us our research questions: why mobile health applications are not sustainable, or why they are not working as they intended. And despite the digital increase in digital infrastructure, there's still gender gap is still growing fast. And the second thing we were curious about was why the gender gap is growing despite the increase in digital infrastructure and mobile health services, especially those mobile health services aim to improve health of women. So here today, I would like to compare 2 mobile health services, Apanjan in Bangladesh and Amakomaya in Nepal. They are both neighbor countries in South Asia. And those 2 maternal health applications, they had the same goals. They both provide pregnant and postpartum women and their families with voice and text messages. So Apanjan also provides an access to a help desk. So we wanted to know about those 2 maternal health applications. They started around the same time, Apanjan in 2010 and Amakomaya in 2011, but they scaled at different levels. Apanjan became national within the 3-year time frame, and Amakomaya became regional, reaching only 7,000, whereas Apanjan reached 2 million subscribers. So we wanted to, first wanted to know why they scale differently within a similar time frame, and at the same time, in what ways they change the health behavior of women, given that gender gap is growing, and how they address some of the challenges that are associated with women in those areas. Sorry. So we identified some access challenges of women in rural Bangladesh and Nepal, and those included influence of gatekeepers in health behaviors and decisions, low literacy rates, limited leisure time due to overworkload, barriers to access to health centers, and high number of local languages and patriarchal norms. So we wanted to know how those 2 maternal health mobile health applications try to address some of these challenges through design. So here are some of the affordances of the 2 maternal health applications. So both of the applications provide SMS and SMS reminders, as well as voice messaging. But different than Amakomaya, Apanjan provides messages twice a week. And in addition, they also provide SMS for gatekeepers, timing choices, helpline, and self-registration, as well as they are available in 3 different local languages, whereas Amakomaya is available in only Nepalese, 1 language. So here we kind of look at how they address some of the sociocultural challenges through their affordances. And Apanjan in Bangladesh provided SMS voice to address low literacy rates, like Amakomaya. But they also address the influence of gatekeepers and patriarchal norms by providing weekly SMS messages to gatekeepers. They also provided timing choices to receive SMS and audio messages to address the limited leisure time of women who are working and spending their time with domestic responsibilities and working in the field. They also allowed for self-registration and helpline to address the low-level access to health centers and limited healthcare workers in those areas, and also provided local content in 3 out of 38 languages, unlike Amakomaya, which is available in only 1 language, to address the high number of local languages in those countries. So in terms of results, again, Apanjan scaled at the national level within 3-year time frame and reached to 2 million subscribers. They were also able to change the health behavior of women, at 67% compared to Amakomaya, which was able to change the health behavior of pregnant women 60%. So our key takeaways, simply supplying digital access is not sufficient in promoting full inclusion among women in marginalized environments. And taking an ecological approach can help to develop more relevant and sustainable programs. What I mean by that is integrating NGOs, gatekeepers, husbands, and opinion leaders in the community. And addressing single barrier through design may not be effective or cost effective. Just addressing financial barriers for women in those areas, providing them free mobile health service or free data is not sufficient, but they also need to address other challenges like gatekeepers or lack of time or lack of leisure time. And all these various different challenges, they need to address them all at the same time rather than addressing just one of them if they want to be sustainable or effective. So thank you.
Thank you so much, Mige. We had some Zoom issues, but I'm glad to note that it has been resolved. If possible, Dr. Bedur, your comments next, please.
Thank you, Muge, for that very nice presentation. And thank you, Shanta. Mobile health applications, my take on it is that mobile health applications hold incredible promise to improve healthcare delivery in the developing world. And it is becoming an important mechanism to improve maternal, newborn, and child health. In locations where there is connectivity, mobile phones are helping pregnant women and mothers to receive messages to improve health outcomes, as we have seen in the 2 mobile applications that you spoke of in Bangladesh and in Nepal. Mobile technology-based health solutions are being utilized for disseminating information, monitoring, and tracking. However, they lack providing training support to community health workers. I think because that is one of the key issues that women in rural areas often face, that because they have low literacy levels, they are unable to get the support from the community health workers, because that's their go-to person in the rural villages. Mobilizing communities is also something, and strengthening interpersonal communication with the community members. Because if we have to go into the villages, into the rural areas, there has to be a certain amount of interpersonal communication with the community members. And we have to, as you have mentioned, okay, in your in the last slide, that we have to take into account the men in the community, the community leaders, and others as well. So thus there is a great dependency on the ownership of mobile phones. You know, if it is like the health applications, health applications have to work, there is a great dependency on the mobile phones, and especially by women, and autonomy to access information that women need. Because women often, on one hand, they don't have the mobile phone devices, but on the other hand, they even don't have the autonomy to access information, because of the patriarchal norms that you have mentioned. So these are some of the stumbling blocks for the pervasiveness of mHealth in various parts of the world. And I would like to mention that so 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 in the sense that, so should the areas in the world that have no connectivity be deprived of mHealth services? Or are there any innovative ways by which mHealth services can work hand in hand with the national health services? And how can mHealth services work equally well in low or no connectivity locations? So dwelling deep into these questions, I have been working together with remote rural communities in India, where health information dissemination is difficult to reach due to no internet connectivity. And in the community network that has been seeded to grow in a rural remote village in Maharashtra, funded by Association for Progressive Communications last year, health information dissemination by the use of spoken tutorial project at IIT Bombay. This is a project that I am a part of now. So this in community user, in which the community uses the local access server. So we host the content, the spoken tutorial content on maternal health on the local access server, and the offline mesh network that we have set up in the community um, uses the women can access the content from that local mesh network. And the health information uses a cultural meaning system, where information is culturally relevant for the pregnant and new mothers are disseminated into the community. And there is also not only a one-way communication between us and the community, but also that new information based on the experiences of the mothers, like the use of particular local grown grain, which can increase the weight of the babies, or information about community vegetable garden that can enable the right amount of nutrition that pregnant mothers and new mothers should have. So these are information that the women in the community tell us about. And all this information is shared in local language by the community through the use of community radios, and can be accessed by all through the local access server. So it is not only the women who are being empowered with this information, but also the husbands are also coming into the fold by understanding that, okay, these are the things that they should give to the women in the house when they are pregnant, or when after they have given birth to their babies. Training the community health workers is also another important motive of ours, which we do through these audiovisual content. And it sort of remains for a long time within the community amongst the women, because these information, the audio video tutorials that we create are downloaded and are viewed in an offline mode by the women in the community. And we, in order to make the reliance on the mobile phones less, what we do is that we use a lot of this offline, lot of community radio content that is the information that is generated by the community, and some of it is like broadcast are shown on a television by downloading the content offline. So during the COVID times, what we have seen is that this type of content, like we have made specific content related to breastfeeding during COVID, because the new mothers, the mothers who gave birth to their children, were asked by the formula milk companies to not feed their babies with breast milk, because that has a great chance of the baby acquiring the virus. So what happened is that we made special tutorials on the relevance of breastfeeding for new mothers in the COVID times for these women in the community, as well as made them aware of the use of face masks, how to use the face mask, how to make the face mask, and how to store and clean the face mask. So this has been a great help to the women in the community in gaining information on COVID as well as their own health awareness. So, according to me, the takeaways that I want to mention is that the M-Health services should not be reinvented each time, in the sense that every time, like Muge has told, like 500,000 M-Health services are M-Health mobile applications are there. But so there has to be a multi-stakeholder partnership between ongoing government schemes. So there are government schemes, and private players can help in the reach out of these services, because sometimes it's only people working in silos. So there has to be a multi-stakeholder partnership, and meaningful utilization of connectivity should be rolled out as an important aspect of internet connectivity. It is just not that we enable connectivity for the sake of connecting the unconnected, but also meaningful utilization of the connectivity, such as the reliance on community networks and like enabling both online and offline connectivity, in the sense that they don't need to be 24/7 online, but a certain amount of offline connectivity wherein the relevance of online things can also be there in the offline connectivity. So this will enable that these services reach to the remotest corners of the world. So overall, these are my comments, and thank you, Muke, for that very nice presentation.
Thank you so much, Sharbani, for those comments, and thank you for sharing your experiences from the Spoken Tutorial project as well. I am looking for any questions in the Q&A, and I don't see any. So I want to make another request to all attendees and those watching. If you have any questions or comments, please do use the Q&A box or use the chat with all panelists and attendees so everyone can see your question. Finally, we have Leon Guaca, who's Dr. Guaca has just joined the One World Connected team at the University of Pennsylvania's Law School Center for Technology, Innovation, and Competition. He is also part of the Dynamic Coalition and will be presenting some of the findings on community networks that we have discovered over the last few years. Thank you.
Thank you, Sharada. Let me just try and share my screen. Can you see my slides now? All right, so in this presentation, I'm going to look at community networks as models to connect the unconnected and underserved communities. So I think the starting point of this work is that we acknowledge that over the years, there's been progress in terms of connecting the unconnected communities. And in a recent report, there's been suggestions that mobile internet is actually surpassed to get 51% of the global population. But when we think of this 51% on the reverse side, it's simply an indication of how much people remain unconnected. So it's at least half of the global population that is still not connected to mobile internet. And when we dig deeper into the regional, into the different regions, we start seeing that there are even regional disparities where in Africa, in Asia, there are even many more people that are actually not connected, not even close to the 51%. And at micro level, if you move into societies and even at household level, we continue to see that there are different there are different access rates among different social groups, and with particular focus on women who continue to have less access as compared to men. So when we look at the whole idea of why do we have so many people who remain unconnected, we think that the current models that are being used to develop internet infrastructure or telecommunication infrastructure, they have demonstrated over years that they're not reliable, or we cannot rely on them to actually achieve universal access or provide affordable access to, especially to rural communities. What I call the current models, we look at governments that are mainly funding the, or governments that have traditionally been charged with the responsibility of developing communication or telecommunication infrastructure. But in most of the poor regions, those governments simply do not have adequate resources to provide access to everyone. And the second part is, when you look at the private sector, they are much more concerned about the financial returns on their investment. And there have been claims that in rural communities or in resource-constrained communities, there isn't much demand that can warrant them to make those investments. So when we look at community in networks, I think that they are possibly an opportunity to provide connectivity to resource-constrained communities. Now, when we look at community networks, these are initiatives that are built bottom-up, and mostly we say that they are community-focused and also they are community-driven. So the communities actually play an essential role in developing these networks. And also we look at it from the cost perspective, that they require less capital expenditure, and even operating them over time, you require less financial resources as compared to traditional systems. So I think the idea of community focus and low cost really addresses part of the challenge, that is governments that are not well resourced, and also the private sector that is profit driven. Now, what we have seen over the years is that the idea of developing these community networks has spread across the globe to an extent that we have diverse versions of community networks. So there was a recent, not so recent, but there was a study to characterize community networks in Africa. And that study identified things such as village telco. There were different initiatives, and all those somehow qualify as community networks, or even just internet centers. Now, we believe that in each of those initiatives, there are unique lessons that we can learn, but also when we compare them, especially if we can compare one region from another, or those that are in the same region, there are many lessons that we can produce that can guide us in terms of developing these community networks. Now, we have 21 case studies on community networks in our database, and their distribution, we can see that we have most of the initiatives are in Africa, followed by Asia. Then we have Europe, then we have America, and then we have Oceania. Now, what this serves to indicate is that the case studies are distributed across the globe. So it's not only in one region where we find these community networks. And if we look at the number of years that these community networks have been in existence, we see that the community networks that are within the 1 to 5 years, there are others that are within the 6 to 10 years, and then we have others beyond 11 years. So we can see that there is a decent spread when we look at the number of years that community networks have, the number of years that the community networks have been in existence. And we believe that we can learn, we can produce lessons from those that have been in existence for a long time to also inform the new networks that are just being formed. And when we look at in terms of the location, we see that there is also, there are other community networks that are actually implemented in urban areas. Then most of them, or from our case studies, most of them are in rural areas. Then in terms of scale, we have more community networks that are implemented at village level, and we have others that are at district level. However, we'll clarify that in terms of the classification of village and district, different countries use different ways of classifying whether it's a village or whether it's a district. So I think that will be also important to note. Now, given that we have community networks that are from diverse regions, they're in different sizes, we need to develop a mechanism to understand how best we can understand community networks, either as an individual case study or how best we can develop mechanisms to compare them. So we believe that we can apply the technology organization environment approach and classify, or rather, we can use this approach to try and characterize either one case study or characterize different case studies, and it enables us to draw some comparisons. Now, from what we have in our database, we found that we have 90% using the unlicensed spectrum, and also in terms of cost, 28%. That can be used to develop other community networks. In terms of organization, 72% reported that they were consulted and they are being involved in the management of the community networks. That includes the process of repairing and maintaining. Then we have, in terms of revenue generation, 67% reported that they have a revenue generation model. However, the revenue generation model that we are seeing in these community networks is such that it does not match what is currently on the market because they are trying to serve the resource-constrained communities. So they are trying not to overcharge. So even though they say they have a revenue generation model, they are unable to recoup either the capital expenditure or sometimes the operational cost. So they continuously rely on funding from government, from private sector. And the main lesson that we found on this aspect of organization is that most of the community networks are trying to engage in strategic partnerships with the academia, with the industry, with governments, so that they are able to generate or to have sustained funding for their operations. One of the, then we move on to the environment. And in terms of the environment, we are looking at where the community networks are operating. And we found from literature, there were indications on the impact that regulatory frameworks are having on the community networks. But from our case studies, we found that the community networks are finding ways to actually overcome this challenge, and others have managed to achieve license exemptions from the governments, and others have managed to demonstrate to governments that the usefulness of these community networks. And as a result, they've actually prompted governments to update and review their regulatory frameworks. But this does not mean that the governments are actually implementing those new regulatory frameworks. And we can also just see maybe from the technology part that 90% of the community networks are using a licensed spectrum and thereby overcoming the regulatory requirements. Then the other challenge, the other aspect in the environment is that most of these community networks are set up in areas where there is no electricity, and there is the option of using solar option. Then in terms of anchor institutions, this is where we are looking at where these community networks can set up. We see that in Africa, only 33% responded that they managed to have anchor institutions, or they managed to find facilities where they could set up and operate. And in Latin America, it was only 20% who had such support. Now, the main concern with anchor institutions is the security of the equipment. So if there is no proper facilities, that can lead to either the equipment being stolen or being destroyed. Now, the next part, we try to understand when these community networks are being set up, what drives them, what drives those who are setting up the community networks. And one of, from our findings is you see that the main or the most reported reason was simply infrastructure development. So we had 19 who reported that the purpose of starting this community network was to provide connectivity. So it was just for infrastructure development. And along with that, it's about developing technical skills in the community or empowering communities to be able to connect themselves. Then there are others who have reported that the community networks are being implemented to support development dimensions. And we can see there is education, which is we had 15 from education. Then we had 10 from health, we had 9 from gender, and we had 7 from agriculture. Now, we believe that it's important to understand what is important to a community. If a community is mainly based on agriculture, then we need to find a mechanism perhaps to link the community network intervention to the particular dimension that the community is interested in. And this approach, we believe, can assist also in terms of funding of the community networks. So the different dimensions, which is health, education, agriculture, they often have some support in terms of addressing challenges which they face. And we believe that community networks are part of the interventions that can be implemented in addressing challenges which are faced across the different dimensions. And we need to develop strategic partnerships with those health institutions, education institutions, or agriculture institutions, such that we can utilize or we can somehow support the community networks in terms of funding. So from what this is work in progress, and what we have at the moment is the data shows that community networks are viable connectivity models. And in our case studies, we have documented successful case studies, such as the Zenzelene network in South Africa. But what we need is to continue producing evidence to demonstrate what works. And at the moment, most of the studies lean towards demonstrating the technical aspect, what technology works. But we also need to produce more evidence in terms of the organization, the nature of the organization of the community network initiatives, and also the environment in which they are operating. Then the next part is about integrating these community networks with other development dimensions. And by integrating them to develop, or by tying them to development dimension, it provides an opportunity to also develop other metrics for impact assessment to understand what the impact these community networks are having. And also, as I indicated earlier on, when we tie them to the other development dimensions, maybe there is an argument to say we can persuade some funding from those dimensions to support the community network initiatives. And in terms of the legal frameworks, while we did not find this particularly to be a major challenge that reported in the case studies, we believe that there are changes to legal frameworks, but we should ensure, or we should provide support to push for implementation of the changes and supporting the different community networks pushing for those changes in the legal frameworks. I think that's the end. Thank you.
Thank you so much, Leon, for your presentation. Leandro, comments?
Yeah, thank you. So congratulations for the study, because it's difficult to gather evidence from many initiatives. In my experience, also I found it quite hard, and I found the draft report very useful to give an overview of the different initiatives. I mean, evidence depends on communities to report, and probably some support from academics to report them in a form that can be reused and can be integrated in further studies. And I found many initiatives don't have any interest or any priority on generating evidence from their activities, and well, it's perfectly respectful, but it happens. I suppose that the study is even more relevant because, I mean, when we talk about connected or unconnected, there are many differences. So there are those who are connected, and I remember in one talk that among the connected, there are those who don't care about the monthly bill, which simply they get it and they pay it. Those who, when they see the bill coming, they need to find a seat. They need to take a good moment, take a coffee, and then look at it and see if they can afford, or that they get disconnected in the middle of the month. So there are different types of connected. And then from the unconnected, you have the self-connected, which are the community networks, those who find their ways to connect themselves. It's like saying, well, we are looking at how people eat. And then if you only look at the restaurants, of course, I mean, not everyone uses the restaurant model every day. And the business models makes a difference. And then if you only see that, you don't really understand how people sustain themselves, because they cook at home, because maybe they choose to do that, or they cannot afford to go every day to a restaurant. But nowadays, with the pandemic, it's not an option. And or maybe because they don't have the skills to use the devices, or because they, as I said, they prefer to do it at home. And also sometimes the unconnected, the mismatch is not simply they cannot afford, it's simply that they don't have money, or they don't have enough money, because they live in a subsistence economy. And then money is a very scarce resource, and they need to invest that money into some other services, which also connects with the previous parts of the discussion about digital skills, especially healthcare and other aspects. So you may have limited amount of money, so you need to choose and prioritize which one you want. And also there is the remaining category of those who are not self-connected. They are simply isolated, and we don't know, for those isolated, we don't know anything. Like maybe there are no evidence, maybe there is evidence that they are not connected, maybe they have fragile forms of connectivity, maybe they don't really need it, who knows. And I saw it also I'm not sure if you mentioned in the slides, but I saw in the draft report, that's also connected to the general aspect of infrastructures. So maybe it has to do with electricity. Without electricity, it's difficult to use ICT technologies. And also education. In these times, if you want to continue being educated, you need to be on a school and have a home connection. Otherwise, things do not work. Um, um, the need and the use of connectivity and community networks also has to do with if people use it for enjoyment or if now people use it for survival. So we can see that in the current situation, for instance, we found that some families realize that what they used to be a tool for getting information, now is it's about a tool to getting education, getting medical services, getting a lot of things that have to be done, work from home. So I think that has changed a lot the meaning of connectivity and the importance of having ways to self-connect yourself if you are not like the target business of the service providers. Um, and one thing that is difficult to see, but you also mentioned, is it's how this connectivity is organized. As said in many forums, the commercial business model is one, but it's not the only one. And some communities can have like traditional ways of um, creating and governing their infrastructures, and it's difficult to compare because they are not designed to be compared. That's the way a particular community works, and another community works differently. And then it's not a choice; it's simply the only choice. Is their way to work, which is more like formal or informal, based on money exchange or based on subsistence kind of bartering of things. So it's a challenge. It's nice to characterize. It's useful to know, but you cannot really do too much about comparisons or rankings or anything, which makes the study challenging. Um, and then I also saw that, I mean, to what extent is useful to collect evidences? I think it's useful to understand the scenario and to see the diversity. And also, as you mentioned in the presentation, it's useful because some communities rely on external contributions from technological knowledge or from investment, from subsidies. Some others do not. But I found, for instance, that for communities, the startup resources are important, like the initial knowledge, the initial hardware, the initial loans, or the money to set up, expand, and maintain the networks. Even I saw a reference to an interesting case where a community has its own infrastructure, and then they interconnect with a commercial provider. So you can also find these interesting partnerships between community initiatives that deal with the retail, like with the local services and the local support, connected to backhaul providers or some other commercial providers at certain point where, I mean, both, it's a win-win situation. The community provides the best possible support, and they collect money, and maybe they pay a fee, and then commercial providers find a way also to make a business in a way that is respectful with the community. So yeah, I mean, kudos to your work, because it's I think it adds to and brings an entry point to other detailed studies and provides an overview which typically is focused on a specific community, and you do the hard work of trying to put them together and extract some commonalities and differences and situate the communities with respect to other possible business models and other ways of delivering connectivity, which is a really, really hard problem. So yeah, that's my analysis and comments and my encouragement for you to continue this work.
Thank you so much, Dr. Navarro. We have one question in the Q&A panel that I would like to now pose. Can transport like a bus be a place for connecting the unconnected? I think this comes from some of the newer projects that are trying to have connected buses. I'm aware of this being piloted in Peru as part of an operation that the World Bank is financing, which I now also am a part of, the organization, not the project. But I wanted to understand what thoughts might exist around transient connectivity more broadly. I think buses are transient, right? Like they're not consistent connectivity.
And if we could ask Sharbani and Claire to join us for the question and answer.
Yes,
so
absolutely.
One of the more interesting aspects about bus travel is they tend to be along arteries where there's a fair amount of density. But in addition, there's access to rights of way where people can actually lay some of the connectivity that will work, that support things. So you'll find that you'll see bus kiosks in a lot of places also being Wi-Fi hotspots, places where you can actually get connectivity because they tend to have certain facilities and resources around them. And it's actually much easier to connect something like buses, even though they are transient and mobile, because they do collect people and they tend to move on higher among even on the mobile internet. Those sorts of roads are sometimes the first things connected, or often among the first connected. So you can see some potential. But what I think you're getting at, Sharda, though, is it's not one technology or one solution that's going to solve everything. And you'll see some solutions work in some areas, and we shouldn't say, well, that's not going to connect everything. We should say, that's great. We've solved part of the problem. And it may not be one grand solution, but rather a cluster of many overlapping solutions that allows us to connect with people.
Any other panelists have any comments to add to that on transient connectivity?
Yeah, one additional comment is that, I think that the advantage of self-connecting is that you can choose how to do it. Because, for instance, when you talk to telecom providers, they say, well, yeah, the quality metrics that we need to comply with. Well, in case there is nothing, and then or you do it yourself, it's like when you cook. You like what you cook because it's what you have. So it's your solution. And also, you can see that when you see a community from distance, it's difficult to imagine what would work. But when you are part of the community, you can realize and you can think a lot and find out how to use the local resources the best. For me, one nice example is there is an NGO called Computer Aid that used to ship computers, second-hand computers in containers to remote locations. And then one day they realized that the container itself was interesting. So now they ship containers that are classrooms in which they put computers, and then they have a classroom where they also have solar panels, so they bring their electricity, and then they only need like a satellite connection or a cable connection to power up this. Now room used to be just the box to bring the computers. So imagination is unlimited. And this is anything that works, it's fine. So yeah, imagination to the power.
So I love the idea of the imagination to the power, Leandro. What's fascinating is there's a lot of these ideas, but you mentioned there's the box, but we also have seen in our studies a lot of questions about backhaul and the costs associated with that, particularly in these very rural areas. But now we're seeing other things like satellite backhaul often becoming, and these are all things that need to be studied because yes, satellite is it's a lot of latency, but it's ubiquitous. I mean, there's just all these different trade-offs, and one of our pleas is to study this more detailed. Something I should have said earlier is really to thank Claire and her organization for its leadership in this area. through its work through Connected Societies, Connected Women, its current leadership of the Equals Initiative on Gender, and their new GSMA Mobile Digital Skills Alliance. It's really pushing out the information we have to make decisions about this on an evidence-based way, which we think is the most important. And I appreciate her emphasis on the growing importance of mobile, which is absolutely true. What's interesting is it is factually true that computer-based programs dominate, and they tend to be right now in terms of digital schools, and after-school programs dominate. And what we don't have is great metrics to understand what is the most effective. That's often opportunistic based on the classroom availability and the like. I think mobile-based education, digital skills training has a tremendous amount of promise. What we need to do is measure it and validate it and figure out how to do it well and figure out how effective it can be to start creating plans to implement this as well as we can. You're muted, Jordan.
I don't see any other questions, but I will take the moderator's prerogative to ask the last one because we have a few minutes left. And the first is to all the panelists today, what do you think are the biggest open questions in terms of understanding how to connect the unconnected today? Let's start with the commenters. Claire?
Sure. So I think there's I think while we have a lot of answers, and certainly that's why we do these sort of big nationally representative surveys to try and answer some of these questions, there's still a lot more to be answered. So, so I'm going to say a few things. So first of all, we don't understand the impact right now of COVID. So we're very lucky in that we're continuing with our surveys at the moment. So when we publish next year, our sort of state of mobile internet connectivity report and our mobile gender gap report, we'll start to see what that impact is. But I think, there will be an impact. And I think from a gender perspective, unfortunately, I'm concerned it's not going to be a positive one. So I think COVID has certainly changed things and will affect key barriers like affordability and such. So I think that's an area we're hoping to fill, but there's more. I think and then there's two other sort of general comments I would make. I would say that we don't have as much of a grasp on some of the impacts around policies in this space. So, how do they affect digital inclusion? Some of those the impacts of some of the policies in different areas. So I think kind of a more detailed understanding of policy impacts around digital inclusion and a range of things would be useful. And we don't have, and we're working now with the University of Pennsylvania team around also looking at the individual impact on lives. Again, there's a lot of information around at a household level or at a national level, but kind of what is the individual impact? And then I would say on digital skills specifically, because that's the one I was asked to comment on, I think there's a lot more learning we need to do around what mechanisms are, we know, there's a lot of content out there, but what are the kind of mechanisms that needed to be delivered for what content? So, when is it appropriate to deliver it on skills? So when we do it, we're learning, for example, you can educate people about sort of what is the internet and some of the basic stuff via video, but some of the more detailed, more advanced skills perhaps need a bit more face-to-face. So, what are the delivery mechanisms that are going to have the impact, and how can we and on which type of skills and with which type of audience? Because I think we need to understand that in more detail if we're going to really scale up our efforts. A lot of the work we're seeing in digital skills space is done face-to-face. That is very resource intensive. Mobile operators have an advantage in that they have a network of agents out there which can deliver it, which is great. But not everybody does. And I think we just need to think. So I think there's a lot to be understood around, delivery mechanisms, which is appropriate for which type of skills, which audience, and how effective is it, and how can we kind of get it so that these things are more effective and we can get those numbers up higher, kind of scalable. So I've answered quite a few things, but I think there's a lot. But certainly, I think like on gender, for example, like some of the policies around gender, what is their impact? And I think there's more to be learned from that. So I will hand over to somebody else now.
Yes, Dr. Navarro or Dr. Belur?
Okay, I can comment. Yeah. So from my perspective, I think we need to finally get out of the trap of telecom monopolies. We go into pseudo monopolies of large telecom providers in general, because I think it's like a stretching the model too much. There's a point where there are customers which are not really customers. They cannot afford the prices, and it's not profitable for them. So no need for them to cover everything. And then if we allow the unconnected to count, because if they are unconnected, how they can raise their voice and how they can find ways or propose ways. It's difficult for governments, which typically sit in the capital towns, to realize and to understand what are the needs for those who are unconnected, who maybe do not speak. Some people say that as it's important to enable people to self-connect, because it's like saying enabling people to cook at home. If you don't have a kitchen at home, you don't have a choice. You need to go to the restaurant or starve. We know that for food is not acceptable, for connectivity is not either. And this pandemic situation has shown that governments have to face sometimes the trade-off of preserving health or preserving the economy. So I think this is the same thing for connectivity. Sometimes they need to preserve the private companies and to empower them, but also at the same time has to preserve the rights of those who are connected and those who are unconnected. And this diversity of models is really a challenge, and that connects to policy, definitely.
Thank you so much, Dr. Navarro. Dr. Belur?
I would like to answer the question from the perspective of not we connecting the unconnected, but now it should be that the unconnected should be able to connect themselves. So given that opportunity to the people, to the unconnected, there is a lot of understanding amongst themselves on how to connect themselves. So, like for example, starting from frugal technologies or the use of technologies that they generally assemble in the villages, or how to generate content in the villages, in the communities, how to use the content in their day-to-day lives. Everything is around that, and I think because how much we are going to discuss about with the policymakers, with the telecom operators to please take the connectivity to the last mile. They are the ones who should need the connectivity, who need the connectivity. They don't have any other means of communication. And but given but when they are asked to connect themselves, I mean, when the communities, they do a very good job of connecting. And in India, what we have seen is that during the COVID times, the gender differentiation has increased. It has become the gender digital divide has widened. And in some of the articles that I have read, and I have read is on that the long struggle that women have put through to become independent, to become autonomous, has again come back to zero. Now again, women are back into their houses, and then they are the ones who don't have jobs. They are relegated to their homes, taking care of their children. So all that struggle, I think it has to again. So perhaps, like Claire mentioned, next year's report will be a good report. We look forward to understand that what has been the real impact of COVID. Um,
Any other comments from Dr. Guaka, Professor Yu, Muge, Dr. Haseki?
I think for me, some of the open questions really stem from the current situation. I think after COVID situation, we've seen a lot of momentum in terms of discussing about connecting the unconnected. We've seen momentum in terms of initiatives, be it from governments, be it from private sector, people demonstrating willingness to actually contribute towards overcoming the challenge. But I think it remains to be seen whether that momentum can be maintained post the pandemic, and see whether governments are willing to still commit resources as much as they did, whether private sector is willing to contribute as much as they did, and even the discussions around the internet. Then also maybe a commitment to using, I think, connectivity for different initiatives. I think those are interesting things that I'll be looking at.
Thank you. Professor Yu?
So I should just, before I do anything else, just thank everyone for their insights, for their time and their participation in this panel. I do think that, it's interesting when we talk about the impact of COVID, there are evidence in the US is that the job losses have been much harder on women than anywhere else. And so I don't think any part of the world is immune to the impact, but also we're well aware that there's a gender differential there. I guess what I would encourage us to think about is to be openly experimental about new ways, and to try to do it in a way that allows us to learn from case to case. In a much broader context, I find many people want to latch onto one model and say, oh, this is the solution to everything. If everyone would just do fiber to the home, it's the solution to everything, or fixed wireless, or some particular model. And the answer has got to be more complicated than that. And what we need is a analytical structure to break it down into components and patience, because learning takes time, and you don't generally often get the entire information about the entire system all at once. You get local knowledge, one piece at a time. And then as you get multiple pieces on the same thing, you'll discover that what worked in one context doesn't work in another context, and you start to understand the reason why. And so it's sort of an incremental long run play. So what that tells you is, someone once told me the best time to plant a tree was 30 years ago. The second best time is today. So on some level, we need to start planting some trees, and understanding that we wish we had a forest already, but given that we don't, and that it's going to take a long time, that we take a longer term perspective and do what we can to try to generate that information so we can make that decision going forward.
Thank you all. So we are almost coming to a close on the session, and I actually learned a lot from this session. So I want to thank all of the panelists and all of the attendees for being with us today, but also for the generous amounts of insights that we have, where we are today in terms of knowledge, what we know of in terms of different models around the world, and also a lot of discussion, especially now at the end, on what remains to be known. What are the things that we need to focus on? What are the open areas that we need to work on? And I think that's really the spirit of this dynamic coalition, which I've been very, very lucky to be a part of. The spirit of the coalition has been always to try and go out there and get as much data as possible, no matter what shape or form, and try to get lessons that synthesize so everyone is not doing the same thing over and over again. And having a discussion on that every year, the platform of the IGF has been really useful because it brings together so many different stakeholders from different parts of the world to both realize and understand where we have gaps that are still missing, but also what we have learned so far. So it has been really enlightening, and I want to take the time to really thank everyone for sharing their time and being gracious enough to share their insights as well as their knowledge in the session today. I know that this session will be available online for a long time to come for others to also get to know and access this. And I hope the attendees both here as well as in the future benefit from the discussion that we had today. I certainly did, and I'm incredibly grateful for it. Thank you. We are just coming to a close, and we are closing exactly on time. So I am also very, very happy that we are able to do so on time. Thank you, everyone, and very, very grateful for your presence.
Thank you so much.
Thank you very much.